Hi, I'm Kevin Brady, Congressman for the 8th District of Texas. With me is Pete Olson. We serve on two key committees dealing with healthcare, Ways and Means, and Energy and Commerce. This morning we met with 20 key leaders in the Texas Medical Center to ask their thoughts on what the biggest challenges facing them in the Texas Medical Center, given that the President's healthcare law is now the law of the land, at least unless changes are made at the ballot box in November. In my view, what I heard from our key stakeholders is that there is a great deal of uncertainty surrounding healthcare in America, that building decisions are being put on hold, investment decisions are being made, put on hold, that in effect, 1/6 of the U.S. economy is essentially frozen at this time. We heard concerns about the President's new healthcare law includes the wrong incentives for people to get insurance, for businesses to continue to offer insurances coverage, and there is, in my fear, is that a number of our businesses will end up having no choice but to drop their health care plans and to move their workers into exchanges, which is both bad for the workers, ultimately bad for the taxpayers as well. And finally, we heard great concerns about the infrastructure. The President's health care law made no effort to try to address the need for more doctors, more nurses, more providers. And while 30 million more Americans, it is estimated, will be covered by the President's health care law, 30 million people in America will not be covered, many of them here in border states like Texas, ultimately in our emergency rooms, in our healthcare clinics, without coverage. And there's a great deal of concern of what that, of how our local providers will be paid for providing necessary health care coverage. Clearly, my belief is that this is the wrong solution for health care in America. I believe we need to repeal and replace it with more common sense reforms. But as the law of the land today, it's critical we hear from our health care providers in the largest medical center in the world. With that, Congressman Olson.
Thank you, Kevin. And Congressman Pete Olson from Texas 22, suburban Houston District, southeast Harris County, going over to Fort Bend County, most of the eastern and central part of Fort Bend County. Many, many people working here at the Texas Medical Center live in Fort Bend County, Texas 22. I want to thank my colleague, Kevin Brady, for putting this event together, because it's a listening session. We came here to listen to the providers of health care in our great state, the Texas Medical Center. No one are better to get their input on how the President's health care bill will affect their business, their quality of care. It wasn't good news. There are a lot of concerns. As Kevin said, lots of uncertainty. Uncertainty that strangles job creation, strangles the development of new medical techniques, new physicians coming into practice, new providers, and that's something we should be concerned about. We are committed in the House of Representatives. If we get the White House back, the President, and the Congress back, the Senate back, we will repeal ObamaCare and replace it with common sense solutions. We won't make the mistakes the Democrats made by jamming something through without coming back and listening to the people affected by this. That's why Kevin and I are here today. If we get the majority back in the Senate and take back the White House, we commit the American people that we will make common sense solutions that ensure that every American has access to affordable health care from the doctor of their choice. And that's what we're here today to do, is listen to the providers. Thank you, Kevin Brady, for doing that. I'm happy to take any questions.
So how important do you think this issue is in re-election compared to the economy in general?
On January, I believe it was June 28th was when the decision was announced. Our phones lit up. So it's very important for our base. They want this bill repealed. I voted every time I had a chance to vote for the House of Representatives to repeal it. It's a bad law. As Kevin said, it is the law of the land. And that's why we're here to start, how can we go forward with this thing, make sure it doesn't do much damage, and hopefully we get the White House and the Senate back. What we need to do fairly quickly, but again, not rushing to do more damage, taking some time, listening to the providers, all the people affected by this, like we're doing here today. And again, this is an election issue. Most American people don't want this big health care bill. They want they want us to identify specific problems with specific solutions, not this one-size-fits-all mentality that DC is so great at doing. And that's what we're here doing, fighting to make sure the American people get their wishes on November. If they do the right things, we vote for a new president, a new Senate, keep us in the Congress, we'll repeal Obamacare.
Congressman Brady, Governor Perry has said that Texas will not be participating in the Medicaid if he called you and asked you for his advice or his support, do you think that's the right move for Texas? That's a lot of money to leave on the table. Free money for a couple of years, nothing's free, but and then a match, disproportionate match for years after that. It could put hundreds of thousands of Texans, give them some type of insurance. Give me your thoughts on that, and Congressman Olson as well.
You know, 2 points, and I want to address Kerry's as well, but you know, I really do defer to the governor and the state legislators on that decision about expanding Medicaid. I know they have real concerns about the teaser rate. Washington often lures states into much greater expansions of all sorts of programs with promises of coverage, which at the end of the day turn out not to be true. I also believe Texas thinks there are more innovative ways to cover Texans in Medicaid. They've asked Washington for a waiver to allow them to put together some innovative programs that would actually put doctors, hospitals, providers together on the same page, working to cover more of those who are poor in Texas. We struggle with covering the uninsured in Texas. We're not a wealthy state. We are a border state with many undocumented here. And so I think the approach of giving Texas the ability to work together and cover Texans is the right approach by them. And then to your approach, as far as come November, it didn't start out this way, but the President's health care law is now a jobs issue. It's cited by businesses as one of the main reasons they're not expanding right now and why they are not hiring. And I'm convinced it is both their fears about the concerns of the cost that will be driven up by the President's law, the concerns over the 21 new taxes included in the President's new health care law, and a fear that if they grow larger, they'll be caught up in the mandates and the regulation that go with Obamacare. So I'm convinced this is both a health care issue and very much a drag on the America's recovery, which, by the way, is the weakest recovery since World War II, dead last. And I fear not gaining much steam.
I'm a little concerned because, you know, you came out here and said this is what we heard from these doctors, you know.
And nurses.
But I don't hear, none of them are here. I'd love to hear from Dr. Wainerdi as to what, because then it's just sort of hearsay, you saying that's what we heard, but, you know.
You don't trust us, we're from D.C.
Congressman Olson, can you address the Medicaid issue? Your thoughts on that? And I know that y'all don't want to stick your hands in state politics, but they look to you, our congressional delegation, for guidance on this, and it's a lot of money.
It is. But Kevin hit it right on the head. One problem we have in Washington is we do solutions for national problems like the healthcare, this healthcare bill, this law now. We impose one size fits all. So what works in Vermont, what works in Utah, work in Texas. And our job is not to impose our will on our state government. I mean, Governor Perry, the one person who attended this event is Kyle Janet, former state senator, who's now been appointed the chairman of the Health and Human Services Commission here in Texas. Kyle's getting up to speed. He's obviously an anesthesiologist. He's got some experience in the practice, but he doesn't take office until September 1st. But he was there listening like we were and getting his input started. He's going to be the one dealing with this in Texas. And we'll be partners, but we won't be the dominators. Again, Texas, we want to give Texas the freedom to make a Texas solution. We've got big problems, as Kevin said, much more diverse population in most states, much more challenges, and we need to give our leaders here in Texas the flexibility that they need to give the health care to our people who need that health care. And as you mentioned, Medicaid is a big problem. But the one thing that was refreshing about that, none of them said we need more money. They all said we need less regulation, less DC. And that's our job to make sure that happens.
I think your question was what happened there?
Well, what did this group ask of our two representatives to do?
Well, what the meeting was about was to hear from the institutions, and the people who were there were a very broad range of representatives, CEOs and others, financial people, from virtually all the institutions. So it was a good cross-section. And among the things that I wanted to emphasize that came out of this meeting, and it was really a listening session by the Congressman, was first of all the fact that not only here in the Texas Medical Center, but throughout the United States, the healthcare industry is basically at a standstill because none of us have any certainty as to what's going to happen. We have a bill passed by one party with no participation from the other. We have the other party trying to repeal and replace it with no participation from the other one. And so there's concern, or at least not yet, there's concern in the vast middle about what's going to really be the future. So we're trying to hold off on, and not just we, but Mayo, Cleveland Clinic, UCLA, Duke, everybody, on construction, on new programs, all kinds of things. And this is also having a very adverse effect on young people coming into the field, nursing, medicine, and so forth, as to, you know, what's this field going to look like. So basically, I think the unanimous position was certainty will be very important. And it's good, oh, wait a minute. But then they said, and I think this was a very well thought out statement by one of the participants, that it may not be just a year or two, it may be a 10-year transition to whatever is going to be the future. And how can we all, including the public, deal with that 10 years or 15, whatever it is, that interim, in a reasonable way? And that dominated a lot of the discussion. Sorry, I didn't mean to interrupt you.
No, I just reported last week that, you know, Memorial Hermann and thereby the nursing schools is going to get millions of dollars from the Affordable Care Act to train more nurse practitioners, you know, hundreds of them over the next 4 years. So, I mean, I don't think it's totally correct that nothing is being done.
Well, no, wait a minute.
To expand
I didn't
programs.
say nothing is being done. I said nothing is being done in the sense of the institutions planning for construction and other big things. We just finished 24 buildings in the Texas Medical Center. We're now building one, which is the result of a gift. Now, with regard to the Affordable Care Act, it has really three kinds of provisions that are globally important. One is that it increases the amount of support for education and research. It decreases the amount of money going to the providers because basically the providers are paying for the amount of monies that's going into these increases, and therefore the margins of the providers from which they get to do their construction and everything else is being reduced. As far as the increased number of advanced practice nurses, everybody agrees that that's an important thing, but the recent number is nothing like what most of us think is a numerical need for advanced practice nurses. I didn't mean to interrupt you, I'm sorry.
Right. But I mean, there are provisions of the Affordable Care Act.
Oh, I'm not here. I am not here
but let me
to
just
say
finish.
it's good or bad. That's
No, I know,
not
but
my
that
position.
increase, you know, compensation rates for primary care doctors, and if Medicaid is expanded, that would bring more revenue to your institutions through more insured patients coming.
All I'm telling you is that the uncertainty as to whether or not, for example, it might be repealed, or it might be replaced, or it might be modified, the uncertainty is a problem itself, not whether it should be or shouldn't be. It is the issue of uncertainty.
But I understand that as a mindset, but can you point to a specific project that's been stopped because of that uncertainty?
It's not just a matter of stop. It's projects that are not started. The amount of construction going on in the country in the health field is vastly reduced from what it was 5 years ago.
And you're saying that's related to the Affordable Care Act,
You
not
bet.
to the natural
No,
cycle of...
No, it is related to the uncertainty of which the Affordable Care Act is one factor. There is a tremendous amount of uncertainty about what the insurance climate's going to look like, what margins are going to look like. The whole way in which, for example, we have had a tradition of fee-for-service. It's very likely that it'll be changed to something much more likely related to outcomes and so forth. So it is the uncertainty of what the field will be like, which is causing people to delay important capital and other decisions. That's the point.
Congressman, there are elements of the Affordable Care Act that seem to have gained some popular support. Keeping your kids on your insurance till 26. The prohibition on refusing people that have pre-existing conditions. If, in fact, congressional control reverts to GOP, at least on the Senate side, and Governor Romney's elected, do you think those are elements that Republican administration, Republican Congress would retain in any future healthcare legislation?
The answer is yes, because it was in the Republican alternative to allow young people to stay on their parents' plans till 26, to prevent people being dropped because of illnesses and pre-existing illnesses as well. Because, you know, we were never offered a vote in that whole process to actually present our ideas on how you would make health care more affordable. The Republican plan takes its roots from the Texas Medical Center, where the advice from Dr. Wainerdi and others was to say, look, healthcare is so complex. Take it one step at a time, do it right, build that foundation, and move on. So the Republican plan, our first step is to lower healthcare costs. The plan we presented is the only one that actually lowers healthcare premiums by about 10%. Is that enough? No. But we need to move, we need to start getting the compass pointed that direction, because the opposite is now true. The law of the land will drive up healthcare costs. We expect between 6 and 20 million businesses to drop the coverage and to move their workers into the exchanges. Individual healthcare premiums, even by the Supreme Court ruling, will now go up about 15%. We think that's the wrong solution. We're eager to have a chance to lay out our ideas, and frankly, our ideas are going to reflect a lot of the insight that we've been given by our leaders here at the medical center. And again, this is the largest medical center in the world. Washington, rather than dictating, ought to be listening to these innovators and how we best deliver affordable care. That's what we were doing today.
Before I leave, and I have to run to another appointment, I wanted to mention a couple of other things that came out that everybody seemed to think were important. And one is mental health and improving the mental health services available to the public and in this community. The fact that the jail happens to be the largest mental health hospital in virtually every community in the country is really an unsatisfactory solution to mental health problems. And it's our feeling that by providing more school nurses, more intervention, more finding ways to help people, particularly youth. The Pelchin Children's Center just became part of the Texas Medical Center. One of our goals there is to try to help intervene with children and keep them from becoming very disturbed if they are slightly disturbed. So that's one area. Another area that I think in which there was strong discussion and support was the idea of some kind of way in which people took care of themselves. And generally among health professionals, the feeling is that about a third of all the healthcare costs in the United States are driven by 6 factors that mix in their behavior: smoking of cigarettes, abuse of alcohol, violence, promiscuity, the recreational use of drugs, and obesity. If you cut those out, you've cut out a third of the healthcare costs of the country. You've increased a lot of the ability of people to pay taxes, and part of that requires people to be more interested in their own health care. And so I think what happened this morning, and I must say, this is a pattern which the 2 congressmen have been having for some time, of coming and listening, of asking penetrating questions, and trying to figure out what is the best way to go from where we are to where we all want to be. There is nobody who's interested in a less healthy country. There is nobody who doubts that we need to take better care of our people. We all agree on this. But we have to figure out a way to be able to do this in an affordable way. And I want to point out that there is not a single country in the world that has solved this problem. England has not, Canada has not, Western Europe has not, nobody. This is a very difficult problem. And I compliment the people who come here, and people come from all parties and all walks to talk about this. And this morning's meeting was really a discussion with health professionals about their ideas. And I do think that at the end of the day, that is going to be very important to everyone who cares about this issue. When you try to do something very fast, you sometimes have some unintended consequences.
Did any of them support the Medicaid expansion for Texas?
Absolutely.
What percent?
I don't know. I think that there are people in the Texas Medical Center who go from one extreme to the other of their politics and of their beliefs. But I think everyone here sees the result of self-induced damage in disease and injury, that sees diseases and other things in which we would like to have more research and more knowledge. And so it's very hard to come out with answers to questions such as what percentage. I don't know. From my point of view, I think the most important thing is for us to come to a national discussion of this issue, which has as its goal improving the health care of all Americans. And by the way, that may mean a lot more prevention and avoidance of disease and injuries than we know of now. That is not incentivized at this time. And it kept coming up time and time again that incenting things does create results. The Dean of the School of Public Health made it very clear that she's an expert on the subject, that the public's health perceptions are very heavily incentivized by different behaviors that government wants to do. For example, when we started the anti-smoking campaign with the tobacco settlement money, we saw real decreases in the amount of smoking by young people. Then when that went away and the money vanished, was used up, the smoking rates went back up. So there are effective ways in which you can deal with these things. And I must run to another meeting, but again, I do think that we had, this morning, in my judgment, a very valuable discussion, and I do think that the Congressman came with an open mind, and I think the discussion was very helpful, at least to me. Thank you.
I just want to point out, I think it's very helpful to have, or revealing really, that Dr. Janik, the acting commissioner, his first week on the job, he was here at the medical center listening to providers. I think that's exactly the right direction going forward to gather the best information.
Yeah, the theme that came out of the meeting this morning was basically these providers said, listen, Congressman, let Texas solve Texas problems. Don't be an impediment to our solving our health care issues. Be a partner. And that's why Kevin and I came here to listen, get their input, so we can go up to Washington and be that partner. And we look forward to work with the people at the Texas Medical Center, Dr. Wainerdi, all the professors there, to make sure that that institution in healthcare in Texas is second to none, like it is right now. That's why I came here today, to listen.
Kevin,
Thanks,
Brady,
Pete.
I just have one more question.
Okay.
And you're uniquely qualified, or one of the most qualified to answer this, because you've been watching for 2 decades now, money coming in, money going out, and crunching the numbers. If the president is reelected, and the Affordable Care Act goes forward, can the country, what are the financial repercussions of that? Do we have to let the Bush tax cuts expire in order to even come close to affording it?
No. At the end of the day, the President's new health care law is simply not sustainable in price. It's already nearly doubled in cost in the first 2 years. Ultimately, the government's going to run out of money to fund this. The worry is when they start robbing Peter to pay Paul. Does it come from Medicare? Does it come from Social Security? Does it come from veterans care, military care? And in the long run, we all know that to be the truth. And so this is going to be a challenge. And the truth of the matter is, the best way to handle government costs is A, get control of spending, and B, get this economy back on track. That's the real answer to almost every financial problem we've got. Thanks.
Thanks, guys.
Do you want to address that?
I just want to kind of follow up on some of my colleagues' comments earlier about the jobs and how this health care bill impacts jobs. I've been a member of Congress for about 3.5 years now, and ever since this health care bill came up, every time I've gone home and talked to small businesses, family businesses, about how this bill impacts them, men, the ones that provide health care, they've told me, Congressman, providing health care is good for my business. It's a recruiting tool, it's a retention tool, I want to do it, it helps my business out. But I spend somewhere between $6,000 to $8,000 per person per year to provide health care insurance to them. I got to compete with the market. If this health goes out of the law, of the land, it'll be incentivized, businesses will be incentivized to drop the health care and pay the $2,000 to $3,000 fine. Everyone I've talked to said, I'm not going to do that. But when the first person in my industry does it, my competitor, I'm forced by the market to drop healthcare bills, the healthcare coverage. As Kevin alluded to, we took a $500 billion cut in Medicare in this bill and added 33 million people to the Medicare and Medicaid rolls. How does that happen? How do you pay for that? It doesn't make sense. Again, the private sector's done a great job, and our job up in Washington right now is to make sure we step back, let Texans do what they want to do. Give them the flexibility to take care of their people, not dictate to them from Washington what they should do. Not that one-size-fits-all mentality that seems to be prevalent in this administration. That's what makes this election so important, but most importantly, we're here to listen. Because these people, the solution to our problems right here in America are right here in the great city of Houston, Texas, and the Texas Medical Center. The experts are out there. We just came, Kevin and I came to listen to them, and we're much better congressmen right now, going back to Washington, take their stories to our leadership to make sure that we don't make the mistakes that Democrats made in passing this bill and hurting our economy and hurting our healthcare industry.
Thank you all.